Hi there, I'm Sheldon McLeod. This is Thinking Out Loud, presented to you by SaltWire. It's my opportunity to talk to people about some of the important stories, and healthcare has been top of mind for a long time. And as a matter of fact, there's an event happening in Charlottetown. Canada's nurses mark World Environment Day at the opening of the biennial convention in Prince Edward Island, planting a tree, symbolic, as you might say, at the end of Queen Street. And it's also an opportunity for us to speak with the person in charge of the Canadian Federation of Nurses Association, or the Nurses Union. Linda Silas is here today, and Linda Silas joins us from Charlottetown. It's so nice to see you, Linda. Thank you for doing this.
Nice to see you.
And the idea of planting a tree and sending a message, it's been a challenging few years for people in the nursing profession in Canada. Tell me a little bit about that.
Yes, the planting of the tree was a message from our members that we have to do more about climate and climate crisis. We're in a crisis ourselves, but we can't forget Mother Earth and the planet. So it was nice to be able to plant a tree in Charlottetown, which they are hosting our convention. Over 1,000 nurses right here. It was right in front of the convention center. So it was symbolic, because right now things are very difficult in healthcare in all sector, from long-term care, home care, to our hospitals. And we're here to re-energize our nurses and give them hope for the future.
Tell me a little bit about the Canadian Federation of Nurses Unions and what it is that you do.
So we're the largest nursing organization in Canada, the largest women organization in Canada, and we're the largest nurses union in North America. We're 250,000 members plus, and it's the provincial unions of the provinces that belong. So we're kind of an umbrella organization. Work directly with the federal government on how the federal government can help on healthcare, but in this situation right now, it's on health human resource. How can they help the provinces, territories, employers, communities to make sure they have enough nurses to take care of citizens?
I hear a lot about not just recruitment, but retention, that we've had a difficult few years, and that human beings can sometimes exhibit behavior that's not very nice, and some nurses are reevaluating.
Yeah, there's that, but they're working so short, so it's hard to look at a patient and say, I'll be here in 15 minutes and 30 minutes, and it ends up an hour later. Look at all the frustration we get when we fly, and there's delays and delays. When we're sick, it's even worse. What nurses are asking, yes, of course, no violence, no bullying, no harassment. That goes for any workplace, goes for yours, goes for mine. But they're asking for safe staffing levels, nurse-patient ratio. Respect the fact that nurses are there to take care of patients, they're there to take care of the sick, and we need enough educated and experienced nurses to do it. So in your intro, you said it right. We need to retain our experienced nurses to recruit new ones.
And in some jurisdictions, they're asking nurses to return after retiring or perhaps leaving the profession. Is money enough to encourage people to do that?
It's money, respect, and flexibility. For sure, the biggest problem right now, when we don't have enough staff, but a lot of employers are kind of caught because they don't have any other choice. And nurses didn't have any other choice because they have no flexibility, no respect. The workload's too much. So they went to agencies. I called it the agencies almost a cancer of our healthcare system, because it will bankrupt our healthcare system. You're paying 2, 3, 4 times the salary of a nurse, and instead of investing in your committed staff, and that's the permanent employees. When we say return, imagine if you're a part-time nurse and your employer would work with you just to increase one shift, maybe 2, maybe a full-time load for a year to help out. And those are ways to compensate and really help your coworkers. So there's a lot of innovation there. Some provinces are better, and some are just ignoring the fact completely.
You use the terminology agency nurses. In Nova Scotia, we call them travel nurses.
Travel nurse, yeah.
And that is a growing trend across this country. It's a double-edged sword. We know that there's a shortage, that there aren't enough workers, but yet, as you point out, additional pay, without the benefits and without perhaps the pension, all of the things that unions and organized labor negotiate for on behalf of their membership. What should governments be taking from the nursing profession when it comes to that balance and what it's doing and how it might be harming morale?
Well, Sheldon, if we could negotiate $200 an hour, we would. But that's not how it works. But that's what some employers are paying nurses because there's not enough permanent employees. It's really to work with the employers and the unions locally on how can we fix the workplace. Because if you have bad work environment, you're going to lose your staff. And then you're stuck. And then you go and get a flyby nurse from a travel agency or a travel nurse or an agency nurse. You're just trying to fill in the holes right now. Your permanent employees are there that cares, that have families in the communities that will stay. So we need to invest on that. I have to say your show is mainly in Nova Scotia. Yep. But Nova Scotia is an outlier here because the Premier understands he's getting involved directly into the Health Human Resource file, from the $10,000 thank you bonus to now they're bargaining with the Nova Scotia Nurses Union, and fingers crossed things will go well there. But he's getting the fact that why would I put money there when I should be investing in Nova Scotians?
And you're in Prince Edward Island, you're in Charlottetown, and you're hearing from nurses at this convention from across this country. Is it the same challenge everywhere, or are there differences regionally?
No, it's the same challenge everywhere. Before, we were only seeing like agency nurses up north, and you'd see travel nurses going for 3 weeks to work in the big north area, and now you're seeing it downtown. For Ontario, the increase went up over 300%. For Canada, it's 500%. Like, we used to talk millions of dollars, and we're talking billions of dollars. So the problem is big. The good thing, the premiers are meeting the second week of July in Winnipeg at their annual meeting, and they've agreed to have a breakfast meeting with us to say, okay, how can we complete the recovery? That's how we're calling it. Because everyone thought after COVID, everything was going to be better. But it's not. It's worse today than it was at the height of the pandemic. Our nurses in Charlottetown across the country are saying, Linda, when are you going to start publishing the numbers on how many near miss did we get? How many patients got sick or died because there wasn't enough nursing staff? And our goal is not to fearmonger. Our goal is really to work with governments and employers to provide safe patient care.
Why did Linda Silas want to become a nurse?
That's a long time ago, Sheldon. Really, I'm a little girl from Dalhousie, New Brunswick, and I wanted to go to university, and I wanted to be into a profession that was going to make a difference. Didn't want to leave too far from home, so I went to the University at Moncton and really got my niche there. Because one thing with nursing is, they say that a young professional is going to change job every 7 years. In nursing, you get that and you stay in the same job. Because I started in intensive care, labor delivery, emergency. I did a little bit on the surgical floor, but that wasn't for me. And then I found the union where I've been working most of my career. So that's what I think attracts a lot of nurses and healthcare professionals. Is they want to make a difference. They want to use their skills to help their community and stay there. And then to be excited by it.
I know a number of young people who have decided to embark on a career in nursing. What advice do you offer from someone who's been through it from the front lines, from the emergency room through till where you're now working in administration and trying to help nurses in their career and in their life balance?
Great question. For me, is telling them, don't quit. Take a permanent job with an employer in your community, an area where you think you will like, and then trust the system, and the system involves us as nurses unions, that we will fix it. And sometimes your permanent job might just be a part-time job, but you will see you move very quickly. If you really don't like working in med surge or labor delivery, well, there's other opportunities that come. Let's be realistic. 25% of nurses are on the cusp of retiring. So that's a lot of jobs opening and a lot of jobs that need a lot of people.
And some people are concerned. You raise the issue of agency nurses, travel nurses, and that we're talking a lot of money. We're talking limited people. It's the human resource right now that seems to be in short supply. And when governments sign deals to get more cash, more dollars, there's this tendency to say, well, it needs to go here, it should go there. Where do you see the challenges right now in that side, the human resource side, for the nurses in Canada under your charge?
See, I keep saying to employers, if you can pay $200 an hour for an agency or travel nurse, why aren't you investing in your committed employees? And it's, yes, the dollars and cents and salaries, but it's also investing, because we hear from nurses, doctors all the time, there's so much paperwork. I spend so much time in front of my computer, I don't know what to do anymore. So why aren't we giving IT services, IT support, porters, receptionists, make their life a lot easier so they can take their precious time and spend it with patients? Those are two immediate things they can do. And then on the quasi longer term, let's work on safe staffing models like nurse-patient ratios, career planning. Ask a young nurse who's 30 years old, where do you want to be in 5-10 years? And then let's build on getting you the proper education or experience or whatever it's needed for you to be that public health nurse or that clinical coordinator or whatever. But we need to invest into our people. Sheldon, healthcare is a very expensive business in Canada, but for Canadians and Canadians who need it, it's a very good investment. And we forget that 75% of total healthcare costs is the people, the human being taking care of the sick, but we don't invest in them. So on the business side, on the financial side, it doesn't make any sense. So our message to the premiers, ministers of health, employers is let's invest into our health human resource.
And if you were to have a son or daughter say, I want to become a nurse in 2023, your answer to them would be what?
Of course, go ahead. I'll help you. It is a great career. You hear from every nurse, they're tired, they're burnt out, but they love what they do. They just hate their job. They love what they do. It's the working condition. It's going to work and thinking, did I do a good job? Am I going to go home at 7:00 tonight? Or do I have to do overtime? What do I do with my kids? And it's that, but they love patients. Still, I've been out of the system for 20 years as an active nurse, and I still have patients that say, Linda, you remember me, or do you remember my father? And that just brings you such a great feeling that you made a difference.
They love what they do, but they hate their job.
Yep.
That's a powerful image, but it sounds like things outside their control that perhaps, again, we're back to what organized labor can help do.
Yeah. And that's why nurses are unionized at 91% in this country. Mm-hmm. And almost every sector, a little bit less in home care and long-term care, we're working on that. But there's a force there, and they're willing unions. Look at the progress that NSNU is doing with the government, and it's a conservative government. Look at the progress in Newfoundland and Labrador with first think tank ever on nursing in the country. British Columbia, they just implemented nurse-patient ratio, and that's Minister Dick, the Minister of Health, who said, you know what? The safety of patient is my responsibility. And if my nurses are saying we need nurse-patient ratios, I am going to implement nurse-patient ratios. So it's there, and now it's going to start, the first one in our country.
What's the takeaway from this conference for your members? What's the takeaway for the public from this conversation?
You'll see at the end of the conference on Friday, there'll be two major themes. One on the hours of work. It is not safe for patients, for nurses to work 24 hours. So you're going to see strong language coming out of us from that. You need to stop it. And the second is on the agency travel nurses. You need to invest into your workforce. So we will be working around those two themes to be able to give the tools to our delegates and work with the province and territories to make it better.
And for the public, what do you want them to know?
Support our healthcare system. And, when you hear the privatization, make it faster to the private hospital, that might be good for you and I. Well, I don't know you, Sheldon, but if you have no comorbidity, which means you have no complication, you might go get your cataract or your knee surgery in a private clinic, and poof, you pay a few $1,000s and it's done. You think you're okay. But we have to think about it as a community. Where do you think those nurses, doctors are going to come from? They're going to come from the public system, where the sick that needs that same cataract can't get it because they might need a hospital bed or intensive care bed. So if we focus on our community and our public health care system, we will get out of this together.
Last question in the news in Nova Scotia today is, there was a data leak, breach of information that disclosed private and personal information of many of the employees within the healthcare system. I assume many of them are nurses. What is your thought on that, and what's being done to remedy it?
Yeah, we always say IT and computers are supposed to simplify our lives, and you hear that and you think, I know Janet Hazelton's been on the phone all day about this, the president of Nova Scotia Nurses Unions, and they will work with governments and employers. The privacy of patients, the privacies of employees is so important to any public sector, any private industry too. So they will work at it. It's hard, it's scary. We think of our bank accounts, our credit cards, and all of that, but they will work at it. It was just not another bad news. We didn't need it, but it happened. Linda
Silas is president to the Canadian Federation of Nurses Unions. Thank you so much for your time. I appreciate it.
Thank you for the opportunity.